Around the world, some inhalers used to treat asthma and COPD are beginning to change. These updates are part of a global effort to reduce the environmental impact of certain inhaler propellants. If you use an inhaler, you may notice that your next device looks or feels a little different. Naturally, that can raise questions. The good news is that the medicine inside the inhaler is not changing. What is changing is the propellant that helps deliver the medicine to your lungs. To help explain what patients and healthcare professionals should expect, we wanted to have a conversation with a pharmacist who works closely with people using inhaled medications every day. Hi, Darush. Could you briefly introduce yourself and tell us about your role?
Yeah, hi, Stephanie. So my name is Darush, and I'm, as you say, a pharmacist. I'm based in London, and I've been involved in respiratory care pretty much ever since I qualified as a pharmacist many years ago. So some of the things I'm involved with is a website called Right Breathe, which is actually over in the UK, we have about 150 different inhaled treatments. So one of my roles is actually setting up this website and making sure people are more knowledgeable about the different inhalers that are around. I'm also passionate about other things respiratory related and do quite a lot of work with the Primary Care Respiratory Society and also the International Primary Care Respiratory Group.
Wonderful. Thank you. I'm so glad you're here today. We have several questions to get through, so I'll jump right in. Can you tell us why manufacturers are even moving towards these next generation propellants in the first place?
It's good news actually, because what we're finding is these next generation propellants are going to be less harmful when we're thinking of global warming potential. And sometimes, we might use the word greenhouse gases or be aware of that terminology. These type of inhalers are called pressurized metered dose inhalers or sometimes puffer inhalers. And what's inside there is an active ingredient, of course, of inhaled medication, but it's mixed in with a propellant. And what's important is if we can get a medicine that can be in a propellant that's got less harm when it comes to greenhouse gas effects, then that can only be good news, and hence why there's a move towards that.
I think you're right. That is good news. I mean, we want to have the tools we need to help everyone relieve their symptoms and that type thing, but we also don't want to harm the environment. So this is quite good. So there are many people around the world who use these inhalers or puffers to help manage their symptoms of respiratory conditions like asthma and COPD. We know that inhalers are changing, but we also know this isn't the first time they've changed in recent years. So can you explain exactly what's changing and what's staying the same?
Yeah, so these type of inhalers, as I said, the ones with the canister or the puffer type of inhalers, they contain a propellant in there. Those propellants were quite different a number of years ago, where it contained something that was actually harmful to the ozone layer. And so manufacturers were advised to come out with a propellant that wasn't going to be so damaging to the environment as such on ozone. But unfortunately, the replacement propellant was still harmful to the what we call GWP, which stands for global warming potential. And what is important and what manufacturers have been recommended and advised to do is trying to find a propellant in there that actually has almost zero global warming type of potential. So it's not only inhalers, it's refrigeration, it's air conditioning units. These type of propellants will be used there. And so if we can actually have something that's medically tested that can help patients get the medicine to the lungs and where they won't feel too many differences, then that can only be a good thing. And manufacturers are beginning to do that now, which is great news.
Yes, that is great news. And it's a little bit of a relief that people are thinking about these things and recognizing them and trying to help us get ahead of the problem. So this is fantastic news. So if we could, I'd love to ask you what happens for patients now. So if a patient receives one of these new updated inhalers for the first time, What differences might they notice?
The important thing, and I think this is what manufacturers are being advised to do, they not only developing or finding a propellant that goes inside the device that also has been medically tested and has got to pass all the different clinical trials and also has to have like approval from the regulators in that particular country. There's once a manufacturer can do all of those things, then they can actually launch it in the country. But what's important is patients need to be aware of what's changing. And sometimes some patients may not notice anything because the packaging looks the same, the inhaler will look exactly the same. But for example, what comes out there, the plume speed, that's coming out quite fast, this one. What you may notice is it slows down a bit more. It may taste slightly differently. The good news is if you're using a spacer, which you should do actually, ideally with a puffer type of inhaler, then a person may not even notice any differences.
That's really good advice. I love for my patients to use spacers with their inhalers anyway. Um, so just to note that if you're using a spacer, you may not notice any difference. So another reason to use a spacer. So that's fantastic. If someone receives a new inhaler and it feels unfamiliar or they're questioning whether it's working for them, what's the best thing for them to do?
I think once the newer inhalers are coming through with the newer type of propellant, what you may find is that there may be some questions you want to ask. And it's always, I think, important to know that the pharmacist could be available to ask questions. And we use a term in the UK, ask your pharmacist. It's a typical strap line that we use. And the other thing is, of course, the patient information leaflet should explain some of these changes as well. But like with any medicine, if something's not suiting, then it's important to raise, and that could be reported to the manufacturer of the inhaler. But as we mentioned earlier, using a spacer with the puffer type of inhaler, you shouldn't notice too many differences. And if a patient is noticing before that they felt like there was if they weren't using a spacer and there was a big jet coming to the back of the throat, that's not actually good because you shouldn't be actually experiencing that. And I think what's important is to make sure that if the medication has to get around the bend and not hit the back of the throat, that can only be good news. So inhaler technique is absolutely important. So if you do notice that you're not getting that taste or that plume hitting the back of the throat, that doesn't necessarily mean it's bad news. Actually, it could be good news because it could more of the medication could be reaching the site of action, of course, which is the lungs.
Right. That is terrific because, I used to try to show people how to use their inhalers and they would say, "Oh, it doesn't, I didn't feel it on my tongue." And I said, "Well, good, because your tongue wasn't having trouble breathing anyway." So that's true.
Exactly.
You mentioned asking your pharmacist in your community, but what role do pharmacists play in helping patients adjust to these updated inhalers?
The good thing about the pharmacies is they've done a lot of work around medicines and they would have hopefully had some good inhaler type of training. And it's normally a skills-based training where they would have got hands-on themselves with a lot of these devices and learned how they work and how to put things together and obviously how, most importantly, how they can coach or instruct a person to get the medication to the lungs, because getting the medication to the lungs is actually not that straightforward. And this is why the pharmacist can help with that type of advice and coaching. The other thing is if you have any questions around what's inside it, or if there's any changes to the propellant, or how should I store the medication, all of these type of questions as well. Again, the pharmacist should have some good general knowledge around that and can support you around that.
That's really wonderful. So, would a pharmacist be able to check the technique of the person coming in with their own inhaler?
One of my top tips is never ask a person, do you know how to use your inhaler? Because most people will say yes. So actually, my way of introducing that, and I agree, yes, the pharmacists themselves will be able to demonstrate it and correct any errors that a person may have picked up. Because believe it or not, 9 out of 10 of us healthcare professionals ourselves may make a mistake when using one of these inhalers just like that. There's 7 steps to using inhaler. The good news is when you use it with a spacer, the amount of errors are reduced. So I think what the pharmacist or pharmacy team members, if they're trained to do this, will be able to talk you through the 7 steps to using an inhaler and be able to observe your technique and correct any of those potential errors that occur.
What is one thing that you would most like for patients to remember about these new inhalers?
I think the main takeaway would be, of course, something has changed. The propellant in there has changed, but the actual device that you're using is exactly the same. But this is an opportunity when something has changed and there's a new propellant in there, and the patient knows that they're going to be doing good for themselves if they can get the inhaler technique right, and they're doing good for the planet as well. So we always say the greenest inhaler, the best one for the planet, is one a patient can use and does know how to use. And this is why the one key takeaway is your healthcare professional can coach you through those 7 steps to using inhaler technique. So if you haven't been shown, just ask, and that will be something that can help you. And of course, there are videos out there that can coach you again, as in you can reinforce and bolster. Yes, that's I've got it right. Those 7 steps are exactly how I was shown, and that reinforces your knowledge because good lung deposition equals good control, and that will mean good for you and good for the planet as well.
And it is really easy for people to miss a step or, this is something that many people have been doing for years, taking these puffers and these inhalers. And it kind of becomes like, oh, I'll just take my inhaler really quick. But it's still important to follow those steps and to do it properly. So I think these are really good reminders. I would like to ask you because I know you have videos that you have done. So would you want to do a plug here for your
Of
video?
course. Yes. So I'd say, first of all, you can go onto the International Primary Care Respiratory Group, IPCRG. There are some good inhaler technique videos. They're actually on the website that we use in the UK called rightbreathe.com. If you go on there, you'll probably notice on some of the inhalers, you'll see probably me doing some techniques talking through the 7 steps. And when I go through those 7 steps, especially the one with the spacer, if you're going to be using this type of device, it's really important just to think about, if a key takeaway, if that coming out fast and you're using this by itself, most of the medicine will just hit the back of the throat. And coordination is not that straightforward. So what this will do is allow you just to take your time, knowing that the medicine, you've got longer time because the medicine's going to slow down a bit more. And then you can inhale the medicine nice and slowly down into your lungs. So rightbreathe.com will show you some of those techniques. And please just don't be afraid to ask your healthcare professional again and again every time you have a review, because that will really bolster your level of knowledge.
Darush, thank you so much. You've shared some great tips today, some wonderful information, and I know the community really appreciates this. Thank you.
You're very welcome. Always a pleasure. Thanks, Stephanie.
Thank you.